Welcome to another edition of our YouTube program. My name is Lucia. I am a very passionate cosmetic beauty formulator at Eastbury, London. Today we have a topic for you which I believe is going to be interesting. It is about does tretinoin weaken your skin, prevent face fat renewal? In this video, you're going to see a scientist and a doctor discuss and argue in a positive manner regarding how tretinoin perform on the skin, hosted by a journalist. All right, I'm going to start by playing the video for you, and we take it from there. Afterwards, I'm going to chip in a few researches of mine that I've made based on evidence.
Welcome to a brand new format on the Honest channel. I'm Claire Johnston, a journalist with a keen interest in all things anti-aging, and today I'm taking my quest for knowledge a step further by putting the minds of two experts together to explore some of the conflicting evidence around tretinoin and what it means for our skin. Regular viewers of this channel will be familiar with both the specialists joining me in the first of a series of dermal debates. Dr Qian Xu is a medical doctor, and she also has her own aesthetics practice where she uses her three-step program with clients focused around prevention, rejuvenation and enhancement. Ivan Galanin is a scientist and founder of Adipose skincare, specializing in rejuvenation through the renewal of facial fat. Over his years of research into facial fat fitness, he's studied the evidence around a variety of ingredients and treatments that may either support or diminish our attempts to recover volume in our skin. And he's got a very interesting take on tretinoin. So I will link to the websites of both these specialists if you want to find out more about them in the video description. I've certainly learned so much from each of them this year, and there is a lot of ground to cover in these dermal debates. So let's get straight into the first one now as we ask, does tretinoin strengthen or thin our skin? Welcome back, Ivan and Dr. Qian, and thank you both for agreeing to join my first little dermal debate, which I'm very excited about. Very excited to have you two as my first guests. So, I mean, you're both known to regular viewers on this channel, and we've really enjoyed hearing from you and learning from you both in the past. So it's going to be fascinating to hear your different perspectives on tretinoin. Dr. Qian, if I could come to you first, because we've spoken previously about tretinoin, and I know that you yourself have used it in the past. I use it daily, and it is hailed as the most evidenced anti-aging treatment on the planet. Unlike a lot of anti-aging treatments, you know, this one has been used in dermatology for decades, and it's the most investigated. So do you think that tretinoin has rightfully earned its place as the gold standard of anti-aging skincare?
Well, I think in terms of ingredients found in skincare, so tretinoin basically is vitamin A, and we will know the benefits of vitamin A on cell renewal, skin regeneration, therefore anti-aging effects. So you know, putting more vitamin A into the skin is always going to benefit the skin, but the question always is how much and how frequently. So you know, a short answer to that, yes, tretinoin has certainly given a lot of people anti-aging benefits, not only in anti-aging but also in treating severe acne as well. There's definitely a lot of evidence for it, and I'm sure some evidence also that's a bit more negative as well. But all in all, you know, the clinical benefits of tretinoin is, you know, you can't really argue against it. So many people have benefited from it. And I have used it a lot in my practice to treat certain things. I don't use it for everything. And I don't necessarily think for anti-aging that everyone should be using tretinoin, but for definitely for certain indications, it is very useful.
Okay. And I mean, negatives that you mentioned there, irritation is an obvious known one. But beyond that, are you aware of any negatives?
That is the main one. I mean, using it topically limits the amount of side effects that you get. So in treating things like acne, you know, some people who take vitamin A orally can have a lot of systemic side effects, but that you don't get from just using it topically. But just the irritation can be so severe that you know, it causes a rash, and it causes a lot of discomfort and even pain, and possibly infection on top of that when it's quite severe. So it's not something that everyone can tolerate.
Yeah.
But for people who have found the right amount that works for them, and they're getting good results from it, then certainly they can benefit a lot from it.
Ivan, you've produced a paper in which you cite a number of clinical studies which you argue suggest that tretinoin not only doesn't improve the structure of our skin, but may even damage it. So why, and what's the evidence?
Yeah, so the evidence is actually really quite clear. But before I go to that, I want to read what's in the label, the FDA label on Retin-A. Tretinoin cream does not eliminate wrinkles, repair sun-damaged skin, reverse photoaging, or restore more youthful or younger skin. So this is the FDA's conclusion on the clinical results that were submitted to the FDA. So that just puts things in perspective. Now, Retin-A does definitely work.
Well, work how, if you've just said that it doesn't achieve any of these things?
Well, it has a small but significant effect on fine lines. So that was proven way beyond any reasonable doubt. So on a 10-point scale, on top of sun protection, moisturizing, Retin-A improved the appearance of fine wrinkles by 0.5 point. So, but there's a cost. I mean, there's definitely a benefit from being the most studied anti-aging drug, but there's also a cost. And that cost is that all of your dirty laundry is there to be viewed and seen in black and white. And really, there are two papers from the investigators who actually helped get Retin-A approved. One looked at histology at 1 year, and another paper looked at the histology at 1 year and then 4 years. And I'll provide links to the papers. And it's, you know, they state quite plainly that amongst other things, the upper dermis is thinned out by long-term Retin-A use by anywhere from 15 to 60% at 1 year and 70% and greater at 4 years. And this is not opinion. This is evidence that has been compiled by the greatest proponents of Retin-A. And there's actually, I'm not aware of any evidence that contradicts this. So usually in science, you know, it's not completely black and white. You've got, you know, some evidence that says one thing and then some evidence that says another thing. And then your job as a reader of science is to balance the one with the other. In this particular case, all the evidence points to the fact that Retin-A does some significant alteration to the at least the upper dermis of the skin.
So you say all the evidence points to that, but Dr. Qian, I mean, it does seem to fly in the face of what has become the accepted view of tretinoin, because even if you just Google tretinoin.
Right, I need to interject here and bring you some of the researches that I've gained on this tretinoin. Tretinoin is a retinoid, a form of vitamin A derivative, and there are different types of retinoids, but our focus today is basically on tretinoin, the most active retinoid. Vitamin A is crucial in mammals and plays a major role in human cells development, in embryogenesis, in vision, growth, production, inflammation, cell differentiation, proliferation, and possible apoptosis of cells, means cells death, be it normal or abnormal. And cell differentiation is fundamental in helping cells become more specialized, hence effective in carrying out specific functions. Chronic deficiency of vitamin A can cause skin and health issues in humans. I gathered some in vivo research study regarding tretinoin, and along the line, I would be sharing my findings with you. So let's carry on.
And skin thinning, you will find dermatologist after dermatologist lining up to say that that's nonsense, and it actually thickens our epidermis. So we'll get into upper epidermis, and Yvonne can explain that in a minute. But I mean, looking at Yvonne's paper, what's your view on what he's just said and whether it could thin or weaken our skin's barrier?
Yeah, I think it's really interesting, actually. And with these kind of scientific evidence, obviously the studies are done to study a particular thing under a particular condition. And I imagine they're random controlled trials. Ideally, there should be random controlled trials. And really, my question is, in the subjects that they studied, how much tretinoin were they using? What concentration, what frequency? Because in clinical practice, in actual everyday practice, the amount of tretinoin, the concentration that I recommend the clients to use, and the frequency really depends on their reactions and how their skin responds to the tretinoin. I mean, tretinoin definitely can thin the skin, and because it does that by speeding up the cell renewal and encouraging the dead skin cells to shed off. So in someone who uses tretinoin perhaps too much, their skin definitely will thin out and they will get the undesirable effects. So it really is, but as with many drugs, medications, even oxygen, if you have too much oxygen, it's toxic. So it's about finding the right level, right concentration, and right frequency to use for a particular individual that's going to give them the benefit without the side effects. And I think tretinoin is probably one of those things that it's kind of has the potential to be damaging, but with a small concentration and if used properly, it can definitely give people some benefits.
So these studies come from actually from an extension of the clinical trial program used to approve Retin-A. So this was the 0.5 and 0.1% concentration daily. And I have to go back and look at the other paper. But this was the clinically approved concentration in a super scrupulous clinical study. This was not a beauty study. This was really from the groups that followed the subjects and got the from the same data set that got the drug approved. So it's and what's really interesting is you see clearly a dose response. So the lower concentration has less an effect than the higher concentration.
Less of what kind of effect? A thinning effect, or
less of a thinning effect than the higher concentration.
You mentioned about these the clinical trials. Is that also? I wonder in the trials, were they using the tretinoin at that concentration to treat a medical condition, or were they using it to treat wrinkles?
No, this was all wrinkles. This was from the wrinkle studies. It was all photo damaged facial skin. So it's all people who have no other medical conditions. They've been selected simply because they have wrinkles.
And at the end of the trial, did they see visible improvements in their skin?
They did, yeah, absolutely, yeah. So and this was also dose dependent. So there were, as I said, there's no doubt that Retin-A does work. It does improve the appearance of fine lines. That's incontrovertible. And so it's and my point is not to scare people off Retin-A. I'm actually completely in wholehearted agreement with Dr. Qian, who says it's all about how you use the product, and what is your, what is your goal? Do you have acne and you're using it to treat your acne, and then the acne resolves, and then you take a break? Do you have a melasma condition that you're treating, and you treat that condition? All those uses, I think, are actually make a lot of sense. But if you're 25 years old and you've heard that Retin-A is the gold standard and that you should use preventative Retin-A, well, for the next 40 years, then
Yeah.
I'm thinking, it's important that we have some voice of reason and some critical mind in which you go into any treatment. And nothing, as Dr. Qian said, nothing is without, there's always like a cost to every benefit. And so
Yeah.
that's really my point, is that we need to keep this in mind. But there are so many, I think, unexplored factors.
I have to come in here. Everything they've said, I totally agree. Use products in moderation. Everything of too much of anything actually produces negative results. There is an in vivo research study that I found conducted on Tretinoin in 2006 by the National Center for Biotechnology Information, Advancing Science and Health by providing access to biomedical and genomic information. And in that study, they performed series of in vivo human testings, studied short and long-term effects of Tretinoin. And here is a 4 years breakdown use of Tretinoin emollient cream. 27 human testers were treated with either 0.01% or 0.05% Tretinoin, firstly for 18 months, followed by 15 months treatment with 0.01 Tretinoin, and finally additional 19 months daily treatments with either 0.025% or 0.05% Tretinoin. And here is the result. 1. The stratum corneum became compact in the first 3 to 6 months. Then it returned to normal basket weave pattern in 12 to 24 months. Remained normal until the end of the therapy. Number 2, granular layer thickness and epidermal thickness were increased in the first 3 to 6 months, returned to normal in 12 to 24 months, and remained normal until cessation of the therapy. Number 3, distinctively epidermal mucin, which is glycoprotein, increased. Melanin continued to decrease throughout Tretinoin treatment. So this is my finding by research, and it's done via in vivo real human studies, which are basically reliable. I also understand what they are trying to say here. It's like Tretinoin, being the most active of the vitamin A's or the retinoids, need to be dose controlled. If you're new to Tretinoin, obviously by prescription, start from a very small dose. Listen to your expert for expert advice. Let's carry on.
Factors or thoughts about vitamin A. For example, if you ask a dermatologist, well, why should someone use Retin-A? They will no doubt tell you, well, it builds collagen.
Mhm.
Well, no, I would say we have no evidence of that. In fact, there's no clear mechanism by which Retin-A would build collagen directly. So in fact, if you take the cells that make collagen, the fibroblasts, and you expose them to Retin-A, they will completely shut down. They won't make anything. And so there may be some indirect way by which, by treating the epidermis, that your skin derives an otherwise benefit. But that case has not been made clearly. And so I think that, despite all the evidence, I think we have to look at the good and the bad and make decisions for ourselves. Does this make sense for me? And not go into it uncritically.
Yeah, and I would agree with you that somebody starting in their 20s for cosmetic, age prevention reasons, you're just better to use a sunscreen and forget about that. I mean, I didn't start using it until this year, and I'm nearly 50, as I keep telling everybody. But when you do start using it, I mean, for me, it was sort of head and shoulders above anything else I'd tried for skin resurfacing, skin smoothing.
Another point I forgot to mention was that from the second point where it says granular layer thickness and epidermal thickness were increased in the first 3 to 6 months. In my own understanding, means, say, when you try tretinoin, you possibly will get a granular layer thickness and epidermal thickness within 3 to 6 months, and later on it returns to normal in 12 to 24 months and remain normal until you stop using tretinoin. Means, could it be what people are assuming to be skin thinning effect, when they don't get that skin thinning effect that they had from the beginning of using tretinoin? This is 3 to 6 months epidermal thickness, and when it goes back to normal, does it feel to the users that there are some visible thinning effect on their skin, that kind of feeling, and they keep on using the tretinoin hoping that they're going to get that similar effect of the 3 to 6 months effect of epidermal thickness? It's like when you start using something new, you start seeing results and you get hooked. At some point, due to certain physiological factors, there may be some changes, and the user may still want to continue to get the early gratification of using such a product. So let's carry on.
But not only that, you can see that it clears your fine lines, or doesn't clear them, but it improves them. It improves the fine lines, not the deep lines, unfortunately. But also, as we age and our skin weakens, that's when you start to get into the things like enlarged pores, which I started noticing in the last year. Your skin's not strong enough to hold them together. So you start getting these enlarged pores. Deals with that. Within a few months, that's all cleared up. So it feels like a strengthening of the skin to the user. I can't say that it gave me any volume, but I think that's almost the case for tretinoin, isn't it? That you've got these millions of users around the world, some who've been using it for decades, and they swear by it.
Yeah, and I would say that experience is completely validated. You can't invalidate that experience. That is absolutely true. The question is, if we do believe, right, which the data suggests, that long-term use will undermine at least a component of the skin, thin the skin. Are there ways that we can use Retin A smarter, right? Can we, use it for a period of time, get that effect on the pores, and then go off of it and see how long it takes for the pores to become enlarged again. I think it's, that hasn't been explored, and I think that, when we look at all of the data together, we'll say, look, this is now without consequences, without negative consequences, and let's think about the best way to use it.
Dr. Qian, that chimes with something you've said to me before, actually. You recommend that you use tretinoin for a certain period of time and then you move on to another retinoid, less potent, a retinal or a retinol of a higher strength. I mean, what's your take?
Absolutely, Yvonne, I agree with that. I do think we need to use tretinoin smarter, in a smarter way. Tretinoin is very irritating and stimulating for the skin. And even with a lot of the skin treatments that I do, the point of doing those things is to stimulate the skin, to make it, to get the skin to do something different, to become more active. But the thing is, there's no point constantly stimulating the skin and not giving the skin chance to heal and recover, because actually a lot of the benefit, the anti-aging benefit that you see, comes from the recovery phase. So I personally feel like it's a good idea to use these really stimulating treatments in short bursts. So you have a course of treatment and then you go into maintenance. And what I tend to recommend people to do is, if they choose to go on the tretinoin for the initial treatment period, which I would recommend about 3 months or so, then go on to retinol for their maintenance, which is a milder form of like a precursor of vitamin A. It's less irritating, it's just a lot milder, and it's safer to use longer term, and people don't get the irritation. Then you give the skin the chance to heal and recover without constantly stimulating it to thin down. And that way I find people get the best results, and they don't constantly get the dryness.
Okay, I'm back again. I understand now vividly from what she is trying to describe, that tretinoin activates the skin and stimulates the skin, helping it to exfoliate. And too much of that exfoliation, because as we age, there is slowness in the skin, sloughing off itself. The skin itself thins out and doesn't hold volume because of loss of collagen and elastin. With too much of exfoliation, and the barrier of the skin being impaired, and plenty of loss of with the presence of transepidermal water loss, the thickness of the skin will not hold anymore, because it's exfoliating at a faster rate with the use of that tretinoin, because the tretinoin continues to stimulate the skin and exfoliate it continuously. Say you use it every day, depending on the percentage you use. So their advice is absolutely on point and beneficial, that the dose that you use for tretinoin, it's really important. It should be dose dependent for safety, to reduce the effects of those exfoliations as we age. Even if you're young, your skin exfoliates when you're young. It exfoliates itself naturally, and then using the addition of tretinoin will double exfoliate your skin, except you're using it for medical purposes, for your acne and so on and so forth. That is where she's coming from. Positive point that she's made there. Let's carry on.
The peeling of the skin, the downtime from tretinoin is really quite difficult to handle for a lot of people.
As a user, I would say I'm on the 0.05 strength, and I wouldn't go up to 0.1, because I always feel that my skin is just on the edge. So if I change moisturizer or it's suddenly colder, all of a sudden I've got that dry skin again. So it's interesting, and listening to you both, I am tempted to come off it for a while. I've got a retinaldehyde that I've used in the past that I find very effective. Give it a go for a couple of months and see. But if these pores come back, Yvonne, I'm blaming you.
I'll be here to take the blame. No, but I think it's important to I just saw this also. We can have a discussion about maybe red light on another occasion. But
what they're trying to say there is that other forms of vitamin A, such as retinaldehyde and retinol, are not as strong and active as tretinoin, so their effects would be less. They take longer for you to see visible results. Okay, so let's carry on.
The clinical program that was studied for red light treated people for a month, and then they saw the benefits continue for 3 months post treatment. And yet no one talks about that that's how you should use red light effectively. And so maybe Dr. Qian's protocol is really something that should be more well known, that you use Retin-A for a few months to provoke the skin, but then you give the skin a chance to recover. I think it's important that these alternative approaches are really given a fair hearing. And so I watched, in preparation for this video, I watched your interview with Dr. Qian, and I was impressed by the common sense with which she approached Retin-A. And I thought, okay, we're going to have a good discussion.
I think quite often with these things, that it's not black and white. It's a huge gray area, and every single individual is different. Skin quality is different, and the needs and goals are different. And when I explain to my clients about using these sort of treatments, I often compare it to going to the gym to do strength training, for example. You can't keep on pushing your body and expect it to keep on getting stronger. You have to give your body to rest. You would train hard for a while, give your body to rest, and then you train hard again. And that's how you get the results. And obviously you have to give your body the nutrition as well. So the nutrition is kind of like the vitamins, where there's vitamin A's and vitamin C's, all the good stuff that you put into the body. Some of that will go into the skin. So you need to have good nutrition, and then using tretinoin as a stimulating agent, or even any skin treatment on the skin, is like the stimulation that you keep on pushing the skin to do more, be more active, produce new.
Okay, what I understand from what she just explained is that what you eat is what your skin will give you. Investing in foods that are high in antioxidants, active antioxidants that are proven by science to work, would help with the betterment of your skin appearances. So beauty from inside out, not just from outside. Say if I eat a lot of things that are not good for my skin, in the long run, my cells are going to absorb them, circulate them around all my organs, and the results will show on my skin, both the intrinsic factors and extrinsic factors, with the UVA, UVB, not using sunscreens and all that, stressful lifestyles, not getting enough sleep. No skincare product would save my skin or your skin when we don't look after ourselves from inside out. In conclusion of what she just said,
new skin cells, but you can only do that for so long without letting it do what you want it to do. So it's kind of, I feel like it's common sense, but quite often with these sort of clinical trials and the medical approach, I think sometimes it's easy to forget common sense.
But it's not a commonly heard approach, actually. It's mostly just people start on it and they keep going with it. Are you saying that you would do a 3-month burst of tretinoin, come off it for a while, and then go back on it?
It depends. It depends on how their skin is. If they feel like they need to, they can. If not, they can just stay on the retinol long term. And most of my clients actually have, they stay on the retinol long term, and they have microneedling once every sort of 4 or 5 months, because the microneedling actually stimulates collagen. That is a collagen induction therapy. So
that I completely agree with. Yeah. And also, I mean, it's clear that retinols are far less inflammatory than Retin-A. And that also we know.
Yvonne, have you got any? Have you seen any evidence? I mean, your own kind of specialist area now is in volume restoration through fat renewal. Are you concerned that tretinoin can interfere with fat renewal, or no?
Yeah, I'm really glad you asked that question, because we're getting, we get that a lot. And so so again, the data is mostly pointed in one direction, that in both in vivo in animal setting and in vitro in a cell setting, if you expose pre-adipocytes to retin-A, it will prevent them becoming mature adipocytes. Now, there may be a question of dose, that if you go to a dose low enough that doesn't happen, but that would be the controversial bit. So I would say that most of the data suggests that retin-A suppresses new fat cell formation, at least in vitro. However, the way you're supposed to use retin-A is and retinols you're supposed to get them into the epidermis, into the stratum corneum. And so if you rub them in, right, then you prevent them from going down the hair follicle and accessing the adipocytes. And also, one other thing that I recommend is to not use a retinol or retin-A in conjunction with hyaluronic acid, because as we discussed before, that will create channels through the stratum corneum that the retin-A can then use to get deeper than it's intended. Because remember, Dr. Qian says it's really intended to act on the upper layer of the skin and to stimulate the production of new keratinocytes. So you don't actually want it to go deeper. So if you're using a retin-A regimen, you shouldn't, I don't think, use a hyaluronic acid.
Good to know. Well, I actually think we've got somewhere here, haven't we? We've actually come to an agreement, funnily enough.
No doubt.
Yeah, no, I am tempted to try that, even just as an experiment. Come off it. I'll give myself till the new year, and then as my New Year's resolution, I'll come off tretinoin for 3 months and see what happens.
I think it's been really interesting to hear about the actual scientific evidence, to look at the evidence and then look at the clinical effects and trying to marry up the two, and to work out, what is the best way of using this ingredient, this anti-aging ingredient. I think that's been really interesting.
Yeah. Well, listen, I love talking to you two, so I hope I haven't put you off. Do you think you would come back and do another chat with me?
Absolutely.
Excellent. And should we look at red light next?
Yeah,
Would
sounds
you be
great.
happy with that, Dr. Qian? Okay, well, let's do it. Thank you both so much.
Thank you, Claire.
Okay, I am back. Everything they've said are sensible. When using products, you should always listen to your skin. Most products should be dose dependent. Do not abuse products. And I agree with what the scientists have said, that tretinoin is meant to perform its work on the surface of the skin. There's no need to drive tretinoin deep into the dermis, where you would have below the dermis, where you will find the dermal adipocytes, the fats that hold the facial structures, and also the proteins that your face needs to be good. So use tretinoin in a dose dependent way. I also believe that nothing would completely eliminate or eradicate wrinkles. Going by FDA's conclusion that tretinoin does not eliminate wrinkles, neither does retinol or other forms of retinoids or derivatives of vitamin A, but they could blur fine lines. As well, I have another research result that I conducted myself. I always base my evidences on facts of researches that I've conducted for you. And here it goes. It says, according to another author named Jeria NM, published with Cosmet in 2013. Okay, I'm going to quote his write-up. And it says, it is safe to caution consumers that overuse of retinoids would thin the skin. causing chronic inflammation, leading to premature aging. So we want to fight aging, but we don't want to, by ourselves, encourage aging. Aging gracefully is the way. Pro-aging is the way. Everything in moderation. And my submission is that you should always listen to your skin. Apart from everything else, your skin has a voice. Be close to it. Open your ears to your skin. Apart from tretinoin thickening, apart from the possibilities of tretinoin thinning the skin, many other, this is my opinion now, okay? My own opinion, which is my opinion, not your opinion. Every opinion matters and counts. Apart from tretinoin thinning the skin, many other intrinsic physiological processes and factors can contribute to skin thinning effects, which is a dermal atrophy. Okay, skin thinning is part of aging. Those intrinsic internal changes occur with all skin as people age, such as decreased thickness and cellularity, decreased thermoregulations with less sweating and poor skin, blood flows, poor circulations, decreased cell turnover, slower immune responses, slow sensory fields, slower sebum production by the sebaceous gland that would normally protect the epidermal skin barrier. So my conclusion in this matter is that tretinoin alone, in bracket alone, cannot be the culprit or the total contributor to skin thinning over time. Other factors inclusively should be considered. Abuse of anything can be negative, so proceed with caution. Follow strict product use advice. Start tretinoin in small doses, dose dependent. If you're new to it, always follow professional advice as prescribed by the experts. And what else have I missed? Use tretinoin smarter, as they've already said. In totality, I agree to everything they've said in this video. Okay, and that is it for now. So I hope you have enjoyed this episode. Please like, share, subscribe, turn on your notification button. Also, leave us your comments in the comment section. See you again, and don't stop smiling. It's only me, Lucia. Bye for now.